The Nigeria Center for Disease Control and Prevention, NCDC, has issued a health advisory to help halt a further spread of the MPOX disease in the country, as concerns mount over the outbreak of the virus across the globe. This alarming increase is linked to a new strain of the MPOX virus, which emerged in Eastern Congo and has since been detected in Kenya, Rwanda, and Uganda. The report.
According to reports, Nigeria cumulatively has over 39 confirmed cases and 0 deaths of MPOX recorded across 33 states plus the FCT from the beginning of the year 2024. In creating proper awareness of the disease, KAFTAN TV had a chat with a medical practitioner, Dr. Olubusayo Modupe, on the possible causes, symptoms, and prevention of the disease.
MPOX is a viral disease. It's called, and most of the time, because the first infection is from animal to man. That's why it's called zoonosis. But after animal infect human being, then it cannot be secondary infection between humans. It's caused by a pox virus. The name of the virus is really monkeypox virus. You know, the old name of MPOX is monkeypox because it was first seen in lab monkeys. But very recently, because it could cause some problem if you tell a man or a woman has monkeypox before people start to stigmatize him that, are you going to turn to monkey or all these things? So that's why one of the reasons why it was changed to MPOX. It has been in and out, but currently it is now an important disease globally. So that's why everybody is again talking about MPOX. Presentation, it presents like the common febrile illnesses we have. There's fever, headache, body pain, backache. There's lymphadenopathy, that's swollen lymph nodes. Then of course there's sore throat, cough. You know, all these symptoms happen in the invasive phase. It appears like what we normally see. But now, within 1 to 2 days from the presentation with fever and others, there's a skin lesion. It starts as macule, flat rash. It becomes raised, which we call papules. From there, it becomes further raised, which we call vesicles. It contains fluid, clear fluids. From there, it now becomes what we call pustules. It's now large, like pussy material in it. After this, of course, it opens up. That's what we now call the scab. But really, at this time, when there's skin lesions, they are very contagious.
So how can we prevent this smallpox?
MPOX.
MPOX.
MPOX, yeah. Because we know it can be transmitted from animal to human. So the first thing is we need to be very careful now about touching animals. One, then we must emphasize hand hygiene, washing our hands with soap and water. We must not forget our old faithful hand sanitizer. Now, if we must eat animal and animal product, it must be properly cooked. Then we know for transmission human to human, close contact is important. And so if close contact is important, then anybody ill at this time should quickly go out and see the physician so that we know is it MPOX or not. Because if it's MPOX, the person must be isolated for treatment. We know it's self-limiting. Within 2 to 4 weeks, it will go on its own. So that's also important because we know, so there should not be contact with the skin lesion because we know they are very contagious at this time. Then we must also be careful because it's also transmitted through droplets when you talk or when you cough or when you sneeze. So it's also very important at this time we maintain physical distancing, especially for those who have it.
Meanwhile, according to the NCDC, there was no significant concern on cross-border transmission of the disease for Nigeria, while assuring that the Center National MPOX Technical Working Group, TWG, is coordinating MPOX response activities. At this point, the doctor gave an update of virus in Nigeria.
I know less than 60. If the last time I checked, it's less than 60 that has been infected, confirmed in Nigeria. Of course, there are more suspected, but confirmed is less than 60. And we know currently it has not killed anybody in Nigeria. Currently there is no vaccine. I'm also aware that the government is expecting vaccines from donors. That's probably the update I can give now. In Nigeria, both the federal, the state and local governments, we tend to be reactive. We are not proactive. We just need to change our way of doing things. Are we budgeting for researches? It's the government that we need to ask that. If researches are even being budgeted for, are the money released? These are big questions. There are a lot of research institutes in the country. What are they doing? These are things they are expected to do, but we might not be able to blame them. Is the work environment suitable for researchers? These are questions that need to be answered.
The NCDC also said that some states have also been put on high alert, including Lagos, Abuja, Enugu, Kano, Rivers, Cross River, Akwa Ibom, Adamawa, and Taraba. Though prevention is better than cure, the doctor spoke on possible tests and treatment for the disease.
Currently, although there are some drugs being used outside, but currently it's more of symptomatic treatment. These are the symptoms that is complaint you treat. Because I said, it is self-limiting within 2 to 4 weeks. It will go on its own. Of course, there are complications. There can be bronchopneumonia. There can be encephalitis. Bronchopneumonia, everybody is aware of pneumonia now. Then there's encephalitis. That means the brain tissue become affected. Apart from there, it can affect the cornea, eventually leading to blindness. There can be sepsis, overwhelming infection. These are common complications of MPOX.
Meanwhile, as part of measures to prevent the spread of MPOX, NCDC has urged members of the public to adhere to proven infection, prevention and control measures. Among these preventive measures are avoiding contact with animals that could harbor the virus, including sick or dead animals in areas where MPOX has been confirmed. David Awokwetu, KAFTAN TV News.